En los anteriores videos de esta quinta edición del Boletin-PIE hemos podido explorar varias herramientas. Por ejemplo, EVIPnet, que es una iniciativa implementada por la Organización Mundial de la Salud y que desde el año 2005 promueve y facilita el uso sistemático de la evidencia para la toma de decisiones en materia de políticas sanitarias en países de bajo y mediano ingreso, y que tiene su referente para América Latina con EVIPnet Américas, la que cuenta con muchos instrumentos traducidos al español y es desarrollado por la OPS. También nos acercamos al proyecto Support, que es una colaboración internacional financiada por el sexto programa marco de la Comisión Europea, la que también está desarrollando un conjunto de herramientas que pretende orientar por la mejor evidencia de investigación disponible a quienes toman decisiones sanitarias. Ahora queremos, a modo de testimonio provocador, que conozcan la iniciativa SURE, Supporting the Use of Research Evidence, o, en español, apoyando el uso de la evidencia de la investigación, que es un proyecto financiado por el séptimo programa marco de la Comisión Europea, el que se realiza en la actualidad en conjunto con los países que forman parte de la red EVIPnet África y que está transformando la forma de hacer las políticas sanitarias en esa región del mundo. Escuchemos algunas anotaciones que Andy Oxman, coordinador del proyecto y experto en la materia, hace al respecto.
In Burkina Faso, where they have, like many places in Africa, a lot of malaria, they looked at, and lots of resistance to drugs that are used to treat malaria. They looked at ways of how to increase access to malaria. That informed the government about strategies that they could use, such as using community health workers to distribute the ACT. That they could then build into their proposal that went to the Global Fund and would then lead to a better use of those resources, as well as better decision making about how to address this important problem, which is killing children and women. So SURE stands for Supporting the Use of Research Evidence in African Health Systems. It's a 5-year research project that's funded by the European Union, and the purpose of the project is to develop tools and resources to help teams of researchers and policymakers make better use of research evidence to inform their decisions. It's done together with countries that are part of the EVIPnet, which is the Evidence Informed Policy Network in Africa. And another initiative called the Regional Eastern African Community Health Policy Initiative, which is in the 5 East African countries. And so we're working with people in those countries to develop tools to help them to produce evidence-based policy briefs that address important problems in each of their countries and provides evidence about those problems and about options to address those problems and about implementation considerations related to the different options that they should consider. We're developing a clearinghouse to address the problem of having access to evidence, so to make it easier to find evidence about health systems when you need it. We're developing tools to help plan and implement dialogues among policymakers and stakeholders to discuss the evidence in their context and to as well as other information that's important in making decisions. And we're exploring the idea of a rapid response service, which is a service to meet policymakers' needs for evidence when they need evidence very quickly, if it's going to help them, for example, if something's being discussed in Parliament or it's in the media. So policy brief can be lots of different things. If you look around, sometimes a policy brief is a study of a research study. Sometimes it's an advocacy document. Very often that's what policymakers think of when they think of policy briefs, is it's a document advocating some particular option that's coming to them from advocates of the option. The policy briefs that we're working on are a different sort of policy brief. They're, as I said, they're documents that start with a problem and use evidence that's available to describe the problem, including the size of the problem and including the underlying factors or what's known about what's causing the problem, to describe options to address that problem and what's known about those based on systematic reviews of the best available evidence that describes the potential impacts, both the benefits and adverse effects and costs of different options. And then evidence about barriers to using those options, and systematic reviews again of implementation strategies that might be used to address those barriers.